Sorry if you're not a fan of math. I know my wife is a big fan of math. She's a mathematician. My daughter is a big fan of math. But I will say that we have to talk a little bit about math when we talk about the crown. So the crown is basically a circle, and pi r squared is a definition of the surface area of a circle. So when you double the surface area of the circle, when you double the radius, okay, just the radius of a circle, that's 2 squared, is 4 times the surface area. So the point of this is that if you're dealing with a very small crown that looks like, oh, you could just transplant that, throw as many grafts as you want, dense packet. The problem over time is that crown, if it doubles, it's 4 times the graft burden. And if it's 4 times the size of it, it's 16 times the size of the surface area. It requires 16 times the grafts. So I'm always cautious about how I can protect the crown and not to do crazy transplants in very young patients and burn out all their donor hair in this area. So please be cautious about this and understand some basic math.